Dr. Mobolaji is a highly qualified educator with a diverse academic background and a passion for biostatistics, holding a Bachelor of Dental degree from Nigeria, in particular University of Lagos, a Masters of Public Health from King's College London, and a diploma in clinical research from Senecal College, Lagos. Dr. Moore brings a wealth of knowledge and experience to the field of biostatistics, currently completing a Doctor of Dental Surgery at the University of Alberta. Dr. Moore is supposed to integrate their clinical expertise with advanced statistical methodologies. With the forthcoming residency in oral pathology at the University of Pittsburgh, Dr. Moore is committed to advancing research and education in the intersection of dentistry, public health, and statistics. Known for their innovative teaching methods and dedication to student success, Dr. Moore is adept at translating complex statistical concepts into practical application in the field of biostatistics. The interdisciplinary approach fosters clinical thinking and prepares students for careers at the forefront of healthcare research and policy development. With a track record of scholarly achievement and a commitment to lifelong learning, Dr. Moore is poised to make significant contributions to the academic community as a lecturer in biostatistics. Passionate about empowering the next generation of healthcare professionals, Dr. Moore is dedicated to fostering a dynamic learning environment that inspires innovation and excellence in statistical analysis and research methodology. And without wasting our time, I would like to hand over the mic to Dr. Mobolaji Moore to do justice to today's topic. Please sit tight and listen. Thank you very much.
Hello, everyone. And, thank you for that introduction. Back in Nigeria, we used to say that "Utalenu die." That was a long introduction. I forced Dada to read. Sorry about that. It was the only what's it called? I had only profile I had already made. I'm very happy to be here. I know it seems like a long time ago, but I remember when I too was the president of University of Lagos Association of Dental Students. Before that, I was the vice president of University of Lagos Association of Dental Students, and I knew how it was to try and get people to come and organize events and stuff like that. And so you guys are doing a fantastic job. So far, I want to say that, and thank you so much. It's an honor, to have me. I remember to have me to be here. I remember back when I was in the penultimate year at 500 level, and there was a doctor who came from University of Pennsylvania. I actually met him last a couple of months ago during my interviews, and he came for the scientific conference. And because he was in University of Lagos, and then he finished, and then he went to do dental residency in oral medicine, it kind of put me on track to having that in mind going forward. When I was, like, okay, this guy has done it, it can be done, and then moving forward in that direction. So that's what I'm here to do, basically, just to give you a full idea of everything and how to go about the process. I'll be concentrating more on the USA, but I will talk broadly about the UK and Canada and also Australia. But the USA is the most feasible path if you really want to get through. I don't want to say the path of least resistance because it's not, but it's the path in which you can get through. Okay, so I'm going to put a full PowerPoint, and you can ask questions at the end of the day. I also have some questions on the Google form which I would address, and then you guys can have questions. I will not take too much of your time, and I'll try and be as engaging as possible. The only person I can see here is Obina, and Obina doesn't have lights. NEPA has done Obina bad. But it's so nice to have every one of you here. So let me just start. Let's get things going. All right. So as she has rattled out some of my degrees already, my name is Mobolaji Moore. I have my BDS, DDS, all of that. So I have this quote. It was when Lupita Nyong'o won the best assistant actor and best supporting actress a while ago, and the quote has gone to me throughout life, and I always hold that quote dearly. It says, "No matter where you are from, your dreams are valid." And I want you to all to have that in mind, that whatever dreams you have, wherever you see yourself in 5 or 6 years, if you do work hard at it, there might be pit stops. It might not be straightforward, but you will definitely get there, no matter where you are from. I was where you are, room 706. No, was it 706? 705, block 7, top floor, the extreme right in final year when I heard this quote. And I transitioned and followed my dream. So you too can do that. All right, just a brief profile. This is a really good picture of me. I did my BDS in 2010, and then I went to do a master's dental public health, and then a diploma in dental public health, and
Hi,
then
Dr. Moore. Sorry to interrupt you. Your screen is not moving.
it's not moving. Jesus Christ,
Yes,
is it moving now?
yes, it's moving now.
Okay, so I guess it won't be a PowerPoint. I wanted to put it like a full screen, but I guess this is the way it's gonna go because it's not moving with me. I don't know why. I should have rehearsed this beforehand, but I usually use Zoom, not Google Meet, but this works as well. Okay, so just a brief profile: BDS, Masters in Public Health, and then a postgraduate diploma in Canada, and then I finished my DDS in April 2024, and then I'm going for a residency in oral pathology at Pitt University. That's University of Pittsburgh, and the hospital is called UPMC, University of Pittsburgh Medical Center, and I'll be in the oral pathology department. So what this shows you in my profile, it doesn't show you the pit stops. You would see a huge break between 2013 and 2018. So 2018 was when I decided to move to Canada through the provincial, what do you call it, permanent residency program. That gave me a platform to go forward. And when I did my master's and diploma in public health in the UK, I had a scholarship to go to do that. And when I finished, they had just cancelled post-study work visa. I remember a friend of mine made a joke. He said, the cow that rushes to England will come back as corned beef. When I came back to Nigeria, it wasn't funny then to me, but everybody else laughed. But, so there are always pit stops and, what's the word? Disappointments along the journey, right? But if you push at it, you get to where you need to be. Okay, so this slide just shows you pathway. Okay, you finished school and want to go to America. What can I do? Or I want to go to Canada. What can I do? So this shows like American states, right? So in Minnesota, straight away with your BDS, you just do an exam and you can start working straight away. In Vermont, 1 year of a GPR residency program, start working straight away. In 8 states, you need 2 years of GPR residency, and you can start working straight away as a general practice doctor and a specialist. And then in 3 particular states, if you have a postgraduate, whatever, in 3 particular states, you can work straight away, both as a general practitioner and specialist. Now, this slide, I put this slide here to show you the ratio of people who get chosen that are directly from, into a residency program directly from with their BDS. If you notice something, the numbers are not really high. Did you see that? Let's see. For the highest number is from ortho. That's 46. And the reason why it is that high is not because of you. It's because of Kuwait, Saudi Arabia, and Malaysia. Those people, they send their people here and they pay money to the school and they pay money to them. They have so much money. I've met so many of them along my line. They have a lower standard for them than us. You know what I mean? And even still, there's another ratio of, for every 1 Nigerian, there are like 50 Indians running for your spot. So you have to have that in mind, that you want to be excellent, okay? And that you want to stand out one way or the other, okay? Now, this is just an idea of how this really, really works. So look at oral and maxillofacial surgery. They had 10,656 applications, and they only took 101. So throughout America, they had 10,656 applications, and they only took 101 of those things. So how do I make my application stand out? What can I do to leave the larger pool of people and get to where they actually see my CV? because you don't expect that the people going through this would look at 10,000 applications. You cannot expect that, right? There are some things you can do to move yourself out of that general pool into the pool that they see. I've been involved in the application process before, and what they do is that they use a computer to screen some people straight away. So, okay, if you don't have this, put them to one side, send them rejection letter, type it out for them. That's their $100 that they paid for the fees. Another thing I want to point out is that sometimes some things, the lower the number of applications, the better chance you get seen. So if you're not particularly, passionate about anything, but just want to do something in dentistry, come and join me in oral path or oral radiology. But people want to make money, so people go to oral surgery, people go to endo, people go to dental-facial orthopedics because they want to make a lot of money. For some reason, pediatric dentistry takes a lot of people as well. I mean, applications, because children dentistry is really, really, really important. Just wanted to have that in mind, so that if you have a plan, okay, I know this is very competitive, I need to do some things, or I know this is not too competitive, I can try and apply directly from Nigeria. But what are the prerequisites? What do we need to know in order to apply, to have? I don't know how easy it is now these days to get a transcript. Back in my day, was you had to bribe one or two people to get it out faster than usual. And once you get it out the first time, then they can always photocopy it. My advice is get your transcript. Have a copy of it. They say they don't give transcript to you, but if you give them a foreign address, they will send it, right? Have a copy of your transcript and have it notarized. It's very, very important, because throughout your career, they would always ask for a transcript wherever you go. So have your transcript and have notarized, certified true copies of your transcript with you. You need 3 references. So what I did before I got into school, not even the undergrad, not even the oral path, before I even did my undergrad in DDS, I got into oral medicine in Seattle. I didn't put that in my profile because I didn't finish. I went to 6 months. I was 6 months into 5, now I went back to DDS, and I will talk about why I did that later. Was I looked for strong references. They don't know people from Nigeria per se. There are a few exceptions. Like if you get a reference from Dr. Akiyosi, his name rings a bell everywhere because he did the technique on local anesthesia. And maybe Dr. Adeyemo's name sounds a bell. They search for the name and they check the HI index, that means the publications that person has, to see how strong a reference it is. But I knew that wasn't going to be enough. So what I did was that I reached out to mentors on LinkedIn, both Nigerian and non-Nigerian mentors. Okay, this is what I want to do. This is my plan. How can you help me? I reached out to 20. 4 people replied, and I got 2 references from those people, right? And those up to now, I still use them as references, even up to now. Never be shy to reach out to people. Your CV is also very, very important. You have to build your CV in a way that sticks, especially the first page. Nobody looks at your whole CV. No matter what they try to tell you, nobody looks at your whole CV. They just look at the first page. If you don't, your first statement, your first page doesn't stick out, you're going to the side. Now, these exams are the most important. The only way to truly move yourself as a Nigerian to the front directly from BDS is to do these exams. Nigeria, I don't know how it is now, but back in my day, it was pass or fail. If you are really, really good, you got a credit, right? And our aim back then was not to have receipt, which was in that time was virtually impossible. I think all of us got one receipt throughout our career, except one person or something like that. But if you had credits, I remember in primary level, we were just 5 who passed at that time. If you had credits, it was good. But there are private schools in India, in Kuwait, that their minimum score is distinction. To just give them distinction like that. So your average GPA will probably be 3, which will not stand out. What will stand out is your TOEFL score, GRE, MBDE, in other exams. I'll talk about each of any one of them. You also have to apply for your residency in 2 different portals in the United States, the PASS portal and the Max System portal. Some of you will be familiar with the Max System from medical students who, They always post it on Instagram, match, and wonder what's going on here. Why are they bragging that they matched? We'd have that one in dentistry too. Take a very good personal photograph. See my own. I went to studio for this picture with white background with nice lighting so that you can stand out. Those things do matter. Looking as professional as possible for your profile makes you stand out. Okay, and then scholarships. If you have, as Nigerians will say, if you have BB, if you're from the all rich South, if your uncle is the governor, please collect scholarship straight away. And that moves you into a different box. He's not collecting money from us. Okay, he's giving us money. Oh, fine. Let's hear what he has to say. If you can do that, then great for you. Okay, so if you're doing residency in America, two key associations. So the American Dental Association is very, very important. You can use it for licensure and for information. Look for postgraduate degrees. And the American Dental Education Association, it can inform you about both the CAPID, which is for undergraduate, PASS, which is for postgraduate, and AAD is SASS, is for PhD programs. So those things are important. Now for Canada, you apply to the schools directly, and Canadian residency programs do not really exist. What they have are pure master's programs, and for a BDS, it means you have to pay. So I remember the best student in our school, his name was Arowo Shegbe. I know if you ask any of the residents, they know him. I'm sure you guys don't know him, but he had a distinction in every year, and he was like a year my junior. He finally got into a residency program in British Columbia. It was residency in oral medicine, oral pathology, and that's what he paid residency. Now, to get in, he had moved into Canada 7 years ago. He got in, he did research assistant, he did publications, he did observerships. They kept on giving people from the school every single year, not him. They kept on giving undergraduates from their own school every single year, not him, until finally they gave it to him. But was it easy? No, it wasn't easy. It's almost impossible. Not impossible. What is impossible? They say things are impossible until it is done. But it is a bit more difficult in Canada compared to the United States. And Canada is more of a master's program rather than a residency. So let's say for a residency in oral, let's say orthodontics, two schools offer that. Manitoba and Alberta. Oh no, three, and Toronto, right? And of those three schools, you pay them. Two, they usually take from within their schools, and they have two spots. Whereas there are 40 orthodontic specialties in America, and one of them takes 41. One particular one takes 41 residents, and majority of those residents are BDS. The catcher is that it's very expensive. But I just want to give you an idea of these things. In the UK, it's the ORE exam, and then the masters as well. And when you do the masters, you pay them, but they pay only the ones that finish from the UK, right? So it's in the United States. If you get into residency, they will pay you, right? One way or the other. They usually do 90% of them. So that's why I'm considering the one that I think is the most feasible. But I will answer any questions on the Canadian or the UK residencies if you have. So the first step in American you can do from Nigeria right there is get a dent pin. Put your information inside this website, get a pin. That dent pin, you use it to open an account later. It's just an identification number for you, right? Another thing you can do from Nigeria straight away is your credential evaluation. If you are very savvy with computers or with immigration, you know that you have the WES and then you have the ECE. So the WES usually use it for immigration, Canada, whatever like that. And there are two types of evaluation. There's a general evaluation and a course by course evaluation. For the American one, you need to do a course by course evaluation. If you're in final year, start the process now. Don't send the transcript yet, but open your account, pay the money, get things going, so that the moment you finish and transcripts are ready, let it go there straight away. Because that is the first step. You need to do your dent pin and then do your course by course evaluation with ECE. You will use it for the rest of your life, right? You use it for the rest of your life. So Might as well start the process now. Now, another way in which you get to the point, one big advantage, more than the Indians, more than the Kuwaitis, is that we are taught in English. And a lot of us, most of us, are very, very good. If you pass JAM in English by yourself, you are good to go. Doing these 3 exams, we've been doing IELTS for a long. If you've ever tried to travel, you've done IELTS many times. TOEFL, they're a bit more technical, but if you work hard, getting a score of 100 in TOEFL is good for you. Now, GRE is maths and English. It's for me, it was the toughest exam I did. So I'm telling you this thing because I actually did this exam myself. For GRE, it was tough. I had to go to lesson and relearn gradients, quadratic equations, and algebra. It was God, and even with that, I got 310 or something like that. 330 is an okay score, but to really, really stand out, you want to get 330. I don't need to change the scoring method now, but it was 300 and something back then. To try and leave that general pool of people. So as I mentioned, they would say, okay, they received 10,000 applications. Okay, how many people got TOEFL of 100 and above? Oh yeah, bring them out. Okay, that's 1,000. Okay, how many people got IELTS band 8? Okay, bring them out. Okay, how many people had GRE? Have GRE score of over 330. Okay, this score will know research. Okay, bring them out. So they will use it to reduce the pool. So if you're in Nigeria now, you can do TOEFL and GRE in Nigeria and IELTS. If you have 313 in GRE, you pass your TOEFL over 100, which is very, very possible. And you pass your IELTS band 8, you can apply, start. You would definitely get an interview because you've left that pool of people of the 10,000 to the 500, right? And that will give you the encouragement. Okay, no, my dreams are going to come true because I have done well here. These are internationally recognized exams. Now, the MBDE is the board exam for America. Everybody needs it. It's pass or fail. If you pass, I always tell people that in course in ULADS, in dental school is harder than this exam, because this exam is the same thing they ask every year. Once you cram a couple of questions, go to Facebook and join an MBDE group, you will see, you just go to the files and see remembered questions, they'll give you dates, February, March, whatever like that. And then you start to cram it, start to study around those questions. If you read it like your life depends on it, it's pass or fail, you will pass the exams very, very easily. The hardest exam that I've done so far in my life is dental school. So don't even worry if you can pass the exam. The only catch, this is one of the rate limiting steps, because you can only do this exam abroad. You can't do it in Nigeria. So you have to have a visa, you have to really travel. So in-house job, if you are really, really dedicated, in those days, I know that things have gone really bad now, but in those days, the salary was about 180,000 a month, and you could save your entire salary and live in money, and then travel for this exam. It takes you out of that pool again. So you have your MBD, you have your GRE, you have your ADAT. You are in a different pool. Do you know what I mean? So this, if you can do this abroad, register, but you can't do this step without the previous steps of a dent pin and credential evaluation in your ECE. Those are the first few steps. Now, the ADAT is another exam that is very, very similar to MBDE, but it has a very, very strong research component. It's one of the exams that were designed for postgraduate residencies, because they found out that people coming in from dental schools don't have a familiarity with interpretation of research or a familiarity of doing research papers. And a lot of postgraduate work is independent research, and they want to know that you can do those things, not just class 1 and class 2. So if you're doing something like oral part, exos class 1 and class 2s are not really what you want to do. This is what you want to know. So ADAT is another exam too that you have to do abroad. They are computer-based exams, and I said, these are the rate limiting steps, because every other step before this one, you can find a way of doing it. But now economics have come into the fore. Someone has to get money to travel, get a visa, and do these exams. Rate limiting steps. Okay. So once you do that, there's a portal. That's the good thing about applying to American schools, that you put all your results, stuff like that inside, and then this portal will send it to all the schools. So you don't have to send individual reference letters to different places. But with this portal, 80% of schools in America are using this portal, and that way, you can do multiple applications, and it's made a seamless transition to different schools in America. There are some schools, however, who don't use the PASS platform. However, you apply those ones directly, but they're very, very few and far between. Most schools use this. But in addition to this, some schools do match. So it was initially started for a couple of medical looking dental residencies, but it has since expanded. The way the match programs work is that you interview the school, and the school interviews you. Then you rank. So if you rank the school 1 and the school ranks you 50, you don't match, right? So the school ranks you 1 and you rank the school 50, you don't match. The match program, in a way, ensures that you want the best, both sides have the best fit. Only a few schools, only a certain amount of programs do match, others don't, right? So in order to have, maybe you want to do something, maybe you are flamboyant, you want to do pediatric dentistry, for instance, you need a PASS application, you need a match profile as well, you need to do the interviews, and then it has to match. That means what they say to you, what they rank you, how you rank them has to match. Some schools, you don't need a match to go to the match portal. So the PASS portal is different from the match portal, right? You need to open 2 profiles there and send it to these 2 independent bodies. The school would actually have agreements with both the PASS and the match program. And then, after you interview, they can make decisions based on that. So not all schools do the match. Not all programs do the match, but certain things do. So general practice residency, advanced education dental dentistry, pediatrics, orthodontics, and dental anesthesia programs. Hospital-based dentistry generally do the match program because they are very, very similar to the medical. So as I said, you want to do the pass and match if you want to apply to certain programs. Now, you must be asking, what kind of programs can I apply for? Right, this is a list of the programs you can apply for. So advanced education is like general practice dentistry. Basically, if you want to do shortcuts to general practice in America without going back to undergrad. Anesthesiology is a very, very new stuff right now because of anxiety, dental pain, and all of that. Is if you know how to, when you're doing your house job and you can set line very well doing house job, this is something that you can do. Dental public health is more of a holistic kind of thing, policies, programs that they target populations. So endo, if you're good, back in my day in school, you guys don't do any endo until house job. If you can see those canals in house job without microscope and your loops, I know we didn't have loops then, I know you guys don't have loops now. If you can find those things well without loops, endo is for you. General practice residency is same with advanced education general dentistry. Really, implants is okay, but it's not like a recognized specialty. I'll talk about that later. Oral path, if you like the medicine part of dentistry and you like the diagnostic and stuff like that, oral path and oral medicine is for you. That's for me. Oral biology, please don't do it except as a stepping stone to something else. So if you want to get to America and be in a dental setting, do oral biology and then apply for what you really want afterwards. Perio is very good, and there's a combination, whatever, called perioprosthetics. They interlock. So, for instance, implants, we don't know that perioprosthetics because perio has to do with tooth supporting structure, and prosthetic has to do with the tooth itself. So there are some specialties that combine both. It will just take a little longer. So what do we need to do? You need to go to the portal here. It's called Adia Pass. Search for what you want, look for it, search, check what programs you like, independently review. Forums are very, very important in order to understand, because once you commit, you've committed. Forums are very, very important to hey, I'm thinking about the endo residency, what should I do? In forums on Reddit, and you see people say, oh no, it's not nice, oh the guy is bad, oh this is bad, and they talk anonymously, so they are able to say things better. So do that. Okay, and then once you've done that, you create an account in this pass. But remember, the previous steps are important. It's only after you've done those previous steps that you should even bother in creating an account. because you need your den pin. And that den pin is very, very important. So this is just like the first page. Okay, putting your biodata and all of that stuff. And then, you continue to check, they'll tell you about the match and the pass. Okay, well, look, this pass might be enough for most schools, but some schools require you to do a match, to go to the match website and do their own thing too, right? So 2 independent profiles there. And then you put your background information, all of that stuff there. And then this is where you sell yourself. So for people that are involved in ULADS, I think you need the phrasing of your work really helps here. So you guys in those days used to do committee on dental health and education, coding. So that is relevant work experience, and that's public health related experience. So you phrasing it properly, your CV will make it stand out. So, okay, I work with communities. We provided preventive dental care for those communities and some restorative dental care as well for low income, low access communities. So wow, and we did that free or subsidized. It's just coding, and thank God for GSK, but they don't know that. But if you phrase it that way, and then you get some referrals from maybe from Lagos State government or somebody, they say, oh, this person is really involved and really passionate about that. Recent experience, I know it's virtually impossible to do so now, but what you can do is that a lot of residents are doing research. They have to, right? The problem is that would they put your name on it? They don't mind you doing the grunt work for them because we have to. They won't sign for you if you don't do the grunt work. But if you can get close enough to somebody, those days we used to carry bag for a lot of these residents. So I don't know if Kisashri is still there now, or we used to do it there. Then, and if you get someone to put your name on 1 or 2, stuff, and so that when they Google your name, it's apart from Instagram, let something else come out. Teaching experience. So before I did my oral medicine initial residence in Seattle, before I actually went to the DDS. So let me just clarify. When I came to North America, I did the exams and I was like, look, I'm not interested in general dentistry anymore. I want to do oral medicine. I want to get into oral medicine. I reached out to a mentor online randomly. She was an Iranian woman and she answered me. And then she said, okay, come, pay for a mini residency program around medicine. And then, let me be able to see something. So I went there, I started teaching with her. I was teaching a lot. And then I followed her to clinics and helped her out and all of that. And then I added that to my CV and she added it to my references, right? So when I got to Seattle and I started, I'd applied for some DDS, whatever, in Canada, and they called me and said, hey, we have an opening, would you come now? It was a very difficult decision because I didn't want general dentistry. But when I spoke to someone, the person said that, look, there'll be more opportunities if you have a DDS because it will mean that they can use you in different ways in the school and you add the prestige of the school, and then it opens more doors for you down the line, especially if you decide that specialty program has become boring and then there's no place they take you to, you can't enter. So if you have only residency, you might be able to get only a narrow license, and then it might not be initially lucrative. But the downside of going back to the DDS that you're going to owe like almost $500,000 because dentistry is not expensive here. So it's the same thing. And then youth service can be rephrased as military service because it's a paramilitary organization, isn't it? So all these things have to be filled up, and your youth service, you need to embellish is the wrong word. You need to bring out, oh, I did this underpaid, subsidized work in different places. Okay, so your CV can stand out. And I said, you're going to put your TOEFL and GRE score. If your TOEFL is not more than 100, no one is going to see you. 90, they tell you minimum of 90, but minimum of 90, you're in the same bracket with the Kuwaitis and the Indians who cannot pronounce W. They were like, or M. They're like, give me the film or the variety. So you're in that bracket, and they have better CGPAs than you. They just have. Whether they are better or not is controversial, but they have better because they have private schools there, right? Even in Nigeria, Covenant GP is different from ULAD GP. You know. All right, and then you fill these forms, you fill the e-forms out, it just tells you about everything and all of that, and then it's time to sell yourself. Now, I want to talk to you about certain programs. So imagine if you're applying for residency and you get into you see comprehensive dentistry, you see aesthetic dentistry, or you see the implant dentistry, special needs dentistry. Those are not accredited, which means you can use them for nothing. It's only if you have a DDS. And say, okay, I did this program in aesthetic dentistry. So, wow, you can be Dr. 90210, right? But on its own, it has no real value. It also could help you, give you a leg into the United States. One of my friends, people would know him now. I think his name, he calls himself the Whiz Dog. He entered into America with a public health management, something like that. He used 1 month in that degree, and then he quickly went to start doing his Kaplan. Now he's a family medicine dentist. You can use this thing to enter, doctor, family medicine doctor. So if you want to use this thing to enter into dentistry there, get some dental experience. If you have the money, fine. Okay. So, but these are the accredited programs that you can actually get into, that you can, even if you finish, I don't want to do any general dentistry, you get a license to work in these fields, right? Imagine getting an endodontic license. You're going to be, there's rich and you're going to be seriously rich. Like if you know you're endo, you don't have to do anything else. They will send, every molar endo will come to you. Say, he's an endodontist. Oh yeah. And your work will stand for you. Orthodontics is particularly lucrative. There's a doctor, his name is Dr. Obama. He's in Canada right now. He has 3 clinics. He has a BDS, and then he did a master's in craniofacial research and orthodontics. He has 3 clinics now. With ortho, he flies to different places from Calgary and Edmonton or around to do the ortho. And ortho works for you. You set up once, you don't have to see that person in 3 months. In fact, let me even make you laugh. He doesn't even set up himself. He has a dental hygiene auto. I did an auto model. He just tells her what to do. Okay, put 016, put the band, do this, put that band up there, drag this. Then he comes in and then he smiles and he does customer service. But that woman does most of the stuff, from brackets to bands, everything. He just instructs, you know. So if you're going to do direct whatever, auto is really, really money driven. Pediatrics too, but there are a lot of pediatricians here, so it's very competitive. Dental anesthesiology is now very, very lucrative because hospitals now, for special needs children here, they really need a dental anesthesiologist for nitrous, to know they can do GA, to know that they understand the procedure and all of that. And then because of that, you can get employed in multiple places, creating streams of income. Now, except you are, there's one guy called Afiz Oladega. He was a consultant in oral surgery. He's now here. He's now practicing as a DDS guy here. So if you're that guy, don't come and do oral surgery here. They won't even look at you because it's the most competitive of all of that. Okay, and then perio is good as well, especially if you like implants, because perio and implants kind of like overlap. And then the flap surgeries and all of that are really, really important, especially aesthetically. So as much as you do veneers, sometimes all of that, sometimes moving the gums around helps you to create a killer smile. So it's also very lucrative. In addition to that, there are some dual majors that you can do. You can combine perio and prosto, you can combine prosto and implant, ortho and perio and stuff like that. And it just takes you more time, but you come out a double specialist. And although oral biology is accepted, but it has no real practical application beyond giving a stepping stone to other things. Okay, so some general tips. Popped up, but general tips. Please find a mentor. I did that. Either online, me, Ogunji, or anybody else, a Nigerian mentor can also help. But somebody who can, help you navigate through those things, especially if you are serious. So there's always the initial gragra of, I expect to get a couple of mails today, but then I'll give you a generic answer. But when I see that you've started making steps, I would start to, because even we want to create a chain of power, a chain of, or a narrative chain of of economic growth for Nigerians. The Indians have that already. When I came here, there was no one to mentor me. There was no one to say, "Oh, come and do assisting in my clinic first," and then we want to create our own chain too. So find a mentor, either Nigerian mentor or foreign mentor, whatever you can find. Please, for God's sakes, finish your boards if you can. Really, 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 is very important. You do a lot of assisting, especially when you do that PR and you immigrate. I didn't talk about immigration here at all, but that's one of the rate limiting steps. The moment you get here like this, if your wife is not a dentist, let her work. You start doing shadowing, assisting, observership, externships. Just write emails to everybody. I don't want money. They want to come and watch. Answer questions there. We used to call it Gra. There's one guy in my set. His name is we used to call him Johnny Gra. The guy just finished a PhD in America now. I think he was an oral surgeon as well in last week. But he was always asking questions, always delaying. We didn't know he was playing a game. Imagine someone's presenting and then one of your boys is asking like 17 questions. Like, I want to go home. What's wrong with this boy? And you don't know he was playing a game. By the time my young manager, he asked my young manager for reference. She's like, "Oh, you were always participating in class." I'm like, wow. But it worked for him. Please, especially the ULADS people, you guys already have that ready already. Do research projects, outreach programs, volunteer. If they tell you to go to Timbuktu, do it. You know what is there. Be involved in the dental society around you. It's the CV. They always introduce you. He was the president of this and that. He was the president of so 3 main strong ones: vice president, president, and Code. Whatever, just embellish it to make it look good. And then team up with other foreign trained dentists, but you have to stand out too. So I remember when I was doing an exam called AFK, that's the Assessment of Fundamental Knowledge in Canada to get into school. So everybody is brilliant coming from wherever they are, but what happens is that the questions are really, really hard, and some people have crammed those questions, right, in different races or ethnicities. So Iranians have their own question bank, Indians have their own question bank, these have their own question, but they don't share it anybody because it's a scaled exam. It's not raw scores, it's scaled. So they said the less questions that you have that everybody gets, it gives you a better mark, right? So because I was friendly with Iranians, with Indians, with Japanese, with whatever, I said, more, don't tell anybody, but come and join us here. We are solving some new questions. More, please. This question is in Farsi, so no one can see it, but come, I will show you because I was friendly. But stand out too. Don't be within the group. Crack a joke or two. Make sure anything that puts you out of the general pool, that makes them remember you. Don't say it's gra. Don't say it's you doing Novasabi. Do it. Crack a joke that gets your attention in an interview. Talk. Research the particular person interview. So yes, I saw you at the IADR. You won't even remember. Say, you say kind of stuff. And that's very, very important. Those things help you to stand out. So now it's time for questions. This is where I think it takes the most time, and then I'll check the questions that you have. Okay. So I will send some questions, and if I've already answered them with my whatever, I'll just go through them. So is it, which countries is it accepted Nigerian grad? And what are the less competitive fields? I mentioned that already, and you saw that list. Oral medicine, oral path, oral radiology are less competitive because they don't have real clinical value. They're more of cerebral, right? And they're easy to get into. Ortho is very easy to get into if you have the money for it. There's a school called Georgia School of Orthodontics. They charge you $600,000, but if you have the money, they'll take you straight away. And now, is it possible? Hey, this has never happened in the history of happening. Nobody has started that residency. Okay, so Dr. Latosi, do you guys know her? She was in pediatrics then. She got into residency in pediatrics here. Do you think you have Dr. Alatosi's experience? Do you think you have her publications, articles, and whatever? She built herself over years to get there. She was a consultant then, and her husband was also a consultant there too. It's possible, but do you really have that? If you get like 319 GRE and you get like 120 in TOEFL, you pass it that hard and a 600 score band, yes, you get it. But you have to be the best. It's not You know what I mean? You have to be the best. You have to have taken time off to study and all of that. It's possible, but nobody has done it yet. Oh yes, so if you want my study notes and all of that, just send me an email. My email is in the thank you page here. It's mobolaji1@youarebetter.ca. Funny thing, they don't call me Bolaji back in Kenya. I was so happy that someone pronounced my name properly here. They just call me Mo. And since I don't want to be called Mobololo or Mobolaji, I just said yes, that's fine. But this is my email address, so it's mobolaji1@youarebetter.ca. Send me an email and I would send it to you. Or tell Shayo, and then I'll send it to a Google Drive so everybody can have access to it, and then they can study whenever they want to. But as I said, I won't take you too seriously until you've made efforts on any of those things. The cost is if you have an uncle in Canada or America, call him now just to say hi first. So that when you start asking him for money, he cannot do all of that on your savings alone. It's not possible. The MBD is like $600, nothing like $600. Flight is like $2,000. You need some support or some savings. It's possible, but it's very, very hard. They cost a lot of money. Each application in the past is $100 USD, right? GR is like I think it's like 100 is like 150,000 in Nigeria now. So there's a lot of money. You need about 3 to 5 million to really, really, really apply. Seriously apply. And how do I manage to afford it? Almost the grace of God, oh Jesus Christ. It wasn't hard. It wasn't easy in any way. So the initial traveling to UK was scholarships. When I came back, I started working and saving again, and then I got a PR. So when I got a PR, that's Canada stuff, and then I started. I did Uber, I did DoorDash, I did security, I did customer service, and I'll be in my book like this, holding it, and then studying while I was doing security, trying to know that the long-term price is important, saving up money. A lot of sacrifices were involved, and some people don't have to sacrifice. Dr. Ibikunle, came in within 6 months, he got into school. Some people waited 10 years. Some people haven't entered school yet. It will depend on how close you are to Jesus or Allah to make it faster. But yes, it's not easy. Should I come back to my home country after doing residency abroad? What a stupid question is that one? You come back and come back and no, I was joking. Don't come back. Make your money and create generational wealth for you and your family. When you finish, you've made that money, then come back and contribute. Buy a dental chair for, I saw the CDH. I was watching your videos on and the CDH now looks really, really fine now. I don't know when they renovated it. But yes, that was really, really impressive. Go and, buy chairs, do inaugural lectures, mentor people. But please, you'll be owing so much money or you have a family here. Make that money. Don't come back. I didn't officially say that, though, so don't quote me. I hope it's not being recorded. Come and contribute your quota to Nigerian society. Or Japan and stay there. What's that? Why go outside of in Nigeria? Okay, so some things, Nigeria has some distinct advantages, and I can tell you now. So all of you think my English is good. Most of it is acceptable. I had a patient that I spoke with very, very slowly and very, very calmly, and she kept saying my accent is too thick, that she cannot hear me. You know what that was? That was subtle racism. She wanted a Canadian. You won't get that in Nigeria. Nigeria one time was in one GTB line, and one guy called me, Dr. Mo, no, come to my office. He carried me to the manager's office. And if you want that kind of respect from the get-go, stay in Nigeria. Two, you can make so much money in Nigeria. There's a doctor called Aman Traore, Smile 360, Dr. Amy Traore. She charges her patients in dollars. She makes really good money. So now Dr. Umi, also on the island, also make really good money as well. Good enough money. And look, being comfortable in Nigeria is better than being comfortable here. I have a house, I have a car, I have everything I want. I have a passport, I can travel anywhere in the world. But the jollof rice is different tasting here. Going to a club or no club, sorry, going to church here is different from going to church in Nigeria. It's just the respect you get in Nigeria because you are at the top of the pyramid there. Here, even some people would think that it is because you are black, you got into certain places. If you are worried about that kind of stuff, stay in Nigeria and be the king in your own castle. But come here, you can live real good. Okay. I answered this one already. Entry exam, during choice of schools, I've done all of that. Talk about the exams and the fees a little bit too as well. So apart from that, let me just also check here to see what other questions you guys had for me. I see some comments. How much are the cost of exams? Yes, well, it took me a couple of years. It took me at least 3 or 4 years to write the exams. This is special to get into our path. Australia. Oh, I didn't even talk about Australia. So Australia is the same as Canada, but they have like the advantages of Canada and the advantages of Australia, of US together. So there's an agreement between Canada and Australia. They recognize each other's specialties, you know, and it's really good. So they pay in Australia as well. But with Australia, please, I really, really encourage you to get that PR first before applying. They do masters and they pay you in Australia too. It's very, very far away. It's costs a lot of money, but they have more spots available for you as a practitioner. It's really, really good. Living costs in America. Oh, so if you are willing to, if you stay in that hostel, don't worry about living cost. If you can survive in that hostel with that toilet, don't worry about living costs. So the fees they pay about 60,000 to 70,000 USD. If you're willing to live normal, you have savings, you send money to your grandma at home. Don't worry about living costs. So if you want to do loud, that's where the problem starts. Do you know what I mean? But if you're not doing loud, no, you can live comfortably with $20,000 a year while doing residency and save like $60,000. Yeah, of course, yes. I will send the slides to you as well. After that, I'll send it to Shayo and then you can do that. Okay, so that's about the full story I have to give you. I hope I did it work within the time. Yeah, and then if you have any other questions to ask me, or if there's anything that wants to step into, I'm available for the next 15 minutes. So yeah, thank you so much. Nobody's putting an applause emoji there. Someone should like put some applause emojis. I can see applause so that people are listening. Yes, 2, 3, 4, 5, 6. Yeah, hey, thank you. This is how you kiss us. So that when you see that, you send me that email, I would now be able to say, yes, I saw Jack, I saw Shai, I saw Obina Santos, and all of that. Yeah. Okay, thank you. I've seen it. Oh, yeah, guys, I've seen it. Thank you so much. Henry, Eniola, everybody. Oh, someone raised their hand. Oh, that was just an applause. Just an applause. Okay, all right. So thank you very much. Over to you, Dosun. What's the next step here now?
Thank you very much.
You 3 times. So when you send me the email, I'll recognize you, Chukudi. Don't worry, you can come. You too, Moniat as well. Eniola. I remember your own name, Eniola. It really rhymes. Don't worry. And Rihanna too. Thank you so much. Thank you, everyone. Okay, Dada, over to you.
Thank you very much, sir. Thank you very much, Dr. Mobolaji. Really appreciate you for coming, for gracing us, and for impacting knowledge onto us. Really appreciate you, sir. I have learned a lot. Personally, I have learned a lot, and I know the journey is not easy, but they used to say, I mean, if you permit me to say the adage that only enter back for it, Siloma. There's way they used to say it. I can't remember. So it's about persevering till the end. If you know what you want, you go for it. So thank you very much, sir. We really appreciate you for having this session with us. We are so much grateful, and yeah, I believe that this session actually has opened a lot of student eyes to pathways actually, because I think there is a question, sir, from Mohammed Yusuf. So I'll leave you to answer that, sir.
Okay, hi Mohammed Yusuf. I'll read this question out first and then answer it. Hi, sir. I'm not that old now. Just call me Bolaji. Sir, I'm a dental student from Abu Zaria. It's a new program here, and my class is the pioneer class. Oh, fantastic. Congratulations. What advice would you give for a new dental student on how to navigate and gather this information? Okay, so the first thing is, of course, is the internet, and the internet is the first way to navigate and look for these things as well. Second thing is your association has to partner and collaborate with other more like what you're doing here now with other more established associations around Nigeria. I remember the one in Borno started a couple of years ago when we had started, and then they had to draw a lot of things from us. They came around and we were, giving them as much information as possible. Sometimes it creates an extra step for you because it's okay, you have to get to Lagos first, and from Lagos get the information before you go abroad. It looks like that sometimes, but the idea is to network as fast as possible. The big drawback you guys will have is because you guys will not have what's what I'm looking for. You guys will not have prestigious people yet. It will be new consultants, but the best draw is as a new university. Everything is new and state of the art, and there's opportunities everywhere. BDS is the same with BDS Zaria or BDS Lagos, and that's the platform that will get you to go. Okay, Dada, back to you.
Thank you very much, sir, for that answer to the question. Really appreciate, sir. I think if there are no other questions, I would like to hand over to my president, yeah, to do the closing remarks. Dr. Shayomi, over to you.
All right, thank you very much, Pusho. Good evening, everyone. Thank you for taking our time to join in. Thank you, Dr. Moore, for accepting our invite and doing this with us this wonderful evening. Well, evening Nigerian time, morning your own time. And thanks to our friends from other schools that joined in. And we are sure that you really had wonderful sessions so far from all the series we've had, right from part one to part two to part three. And here we have part four. And we wouldn't have it in any other way better than this. So thank you for taking out time to join in this evening. Do have a wonderful evening. Yeah, Dr. Dr. Mujida. All right, thanks for joining me. All right, do have a wonderful evening, everyone, and do enjoy the rest of the day, Dr. Moore. Thank you very much.
Thank you
Bye.
all. Have a great day, guys. Bye.
Bye.